Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Scarlett Saitta. She's an osteopathic medical student. Today's Kevin MD article is Integrating Vitamin Education in Mental Health Care. Scarlett, welcome back to the show.
Thank you, Dr. Fo, for having me on again. It is truly an honor.
All right. Tell us what your latest article is about.
So, in summary, the article was about in integrating vitamin education into medical education. I feel like a lot of times it seems to be very left out and seen
Mhm.
as just kind of like alternative medicine, or even as far as quackery. But then I read a lot of the studies, some of which were published in journals such as JAMA, and I saw how for some patients it could really be quite helpful, especially for treatment-resistant depression, and especially with 1 in 5 American adults living with a diagnosed mental illness, and many more living in complete silence without that diagnosis, but their lives and people around them are still greatly affected. So, for example, there's many psychiatric patients that are deficient in key vitamins, such as I believe it was 42% of people experiencing depression are deficient in vitamin D, and up to 40% of inpatient psychiatric patients have a deficiency in vitamin B12. Moreover, 70% of patients with depression have low folate, and all of these also stunt the effectiveness of traditional pharmaceutical drugs and traditional cognitive behavioral therapy.
So I know that in medical school, there isn't much time spent on nutrition in general, let alone vitamins. Has that been your experience from what you've heard and talking to your peers about the lack of nutritional education?
Yes, but I guess it would depend on the medical school. I do have friends that are at other medical schools, and I will say that I am definitely more proud of the progress that medical schools have made with integrating nutrition and medicine, especially considering that only about 10 to 20% of someone's health is determined by what happens in the doctor's office or at the hospital. A lot of the other is influenced by policies, but also our access and our willingness to integrate lifestyle changes.
Tell us more about the study. You mentioned that connection between various psychiatric diagnoses and a deficiency in vitamin D, B12, and folate. Is it only associated with depression? Are there any other psychiatric conditions that also may be affected by nutritional or vitamin deficiencies?
So I mostly looked at it for anxiety and depression. So for example, there was one study done in 2014 that demonstrated that patients with a vitamin D that were supplemented with vitamin D, and they were also already deficient in vitamin D, they had their depressive symptoms reduced by 92%. There was also a subgroup of other studies also published in 2024 that said vitamin B12 enhances pharmaceutical antidepressant effectiveness. It can also delay the onset of depression. Methylfolate, which is a bioavailable form of folate, a little bit easier for the body to take in and absorb. It led to significant symptom improvement for 81% of patients with treatment resistant depression, as opposed to just 39% of study participants that were taking a placebo. And that study was published in 2012.
So I'm hearing from these studies that repleting, for example, vitamin D leads to a significant decrease in depressive symptoms. Like I think you had mentioned 90+% improvement, right? So why isn't this done more often? Why are we not hearing as often that these vitamin deficiencies are so closely linked with these psychiatric conditions?
That is a very good question. To be honest, I'm not completely sure. Maybe sometimes it's because the vast majority of studies are only done on pharmaceuticals. It could also be because although vitamin supplements can be very helpful, they're also not as regulated, which is why you turn the vitamin over on the back and it gives you
Hmm.
that disclaimer. It could also be because, so for example, there was a study published where they grabbed 10 different bottles of melatonin off of just random grocery store shelves, and zero of them matched the actual amount. So it could definitely vary, like of how much amount of like vitamin D or folate is actually in there. But that being said, there are brands that were more reliable than others, and I think there should be more studies and education on that. It could be because when a lot of people hear it, their mental biases just tell them that, oh, this is quackery because I wasn't trained on it. So whenever we say that makes sense to me, all we're really saying is that fits my preconceived mental biases that were shaped through what I've been taught, what I've experienced, what I've had my friends experience, etc. So that is why I believe it's not happening as much.
So I think you bring up a good point in that a lot of studies sometimes are funded by pharmaceutical companies, and if there isn't a positive result for their specific drug, then sometimes these studies aren't funded. So when we're talking specifically about vitamins, it doesn't really fit into that profit paradigm of pharmaceutical companies that funds a lot of these studies. Now, for patients who may be looking to supplement some of these vitamins you're talking about, folate, B12, and D, you mentioned that sometimes these vitamins don't always contain the right amount of vitamins, and there's a lot of that wild west when it comes to these supplements. Tell us from a patient perspective what they should be looking for whenever they look for vitamins on the store shelves.
For what I know about vitamins in particular, I might backtrack on the question a little bit because there's not a lot of information out there of like which vitamins are very true to their labels,
Hmm.
which is why I think medical education from providers would say, I recommend this brand because studies have shown that it's very accurate to the dosage. I sadly don't have a really good answer for that,
Hmm.
but I would also say to be sure that you have a test to show you're actually deficient in that vitamin. Even though the tests are not used as often, they still exist because not every patient with treatment resistant depression has a vitamin D or a folate deficiency. And also, too, if you take too many vitamins together, especially vitamins that are not completely accurate to their label, especially if they are fat soluble, then that could end in very severe results.
So tell us more about this field of nutritional psychiatry. If you were in charge of the medical curriculum, tell us the type of changes that you would make to better educate future clinicians. Because, like you said, sometimes if it doesn't fit into the paradigm in which they trained in, they could be less accepting of that information. So, what kind of changes would you make in a medical curriculum?
So the kind of changes I would make in a medical curriculum, and some medical schools already have have this, but I would definitely incorporate a very healthy diet as kind of like the basis of the medical education for this class. So, however, a healthy diet now, even when you teach it very well and very specifically of like what constitutes a healthy diet, there was actually a landmark study that I found at the from the University of Texas, and it compared USDA data from 1950 to 1999. And I think it was over 40 different fruits and vegetables.
Hmm.
And they found definitely very reliable declines in like protein, calcium, iron, vitamin C, riboflavin, and various other nutrients. So over time, we basically bred crops to yield size, to basically be larger, have them ripen faster, and our fertilization methods aren't exactly keeping up with that or allowing the plants to absorb like the most nutrients from the soil. So that also needs to be taught. And also, just to put it into perspective, a fun fact that I found out is that one analysis concluded that you need to eat about 8 oranges today to get the same amount of vitamin A that your grandparents once
Mm.
got in 1950. So incorporate that, especially show that even though like a healthy diet is very good, there's a lot of nutrients that it's very short for. Also, train students to know what kind of tests to order. Like what kind of deficiencies tend to be common in people with depression, anxiety, or various mental health issues. Also teach them how to respectfully and non-judgmentally figure out what their patients are eating and their lifestyle, as well as their access to food, because there are many Americans that live in a extreme food desert, especially out here in Arkansas, where the only grocery store is like a Dollar General.
Hmm.
And assess from there like which brands and which dosages of vitamin would be most helpful to that patient, but also be sure the vitamin is in a form where the body can very easily absorb it, since there are some supplements out there where the body doesn't completely absorb it. So in short, that is how I would train medical students to handle this issue.
As far as you know, are there any studies on the horizon regarding vitamins in general and associations with diseases that traditionally may not have had that association? What do we have potentially to look forward to?
That I am not completely sure of, but in recent years, we have been hearing more about vitamin supplementation. And I remember hearing stories of, even though I know these are just anecdotal evidence of friends or people that maybe they were being treated for depression 10 years ago,
Hmm.
and now maybe other people are being treated for, let's just say, depression now, and the doctor is asking for or ordering tests for their vitamin D, especially, and their folate
Hmm.
levels, as well as various other vitamins. So, for example, I did have a friend who had treatment resistant depression, and she finally found a physician that ordered a test for her vitamin D levels, as well as various other levels, and she was supplemented with vitamin D. And after after that, even though I know it's just one case,
Hmm.
she didn't even need like antidepressants after that, and she basically recovered from depression, as well with cognitive behavioral therapy.
We're talking to Scarlett Saitta. She's an osteopathic medical student. Today's Kevin MD article is Integrating Vitamin Education in Mental Health Care. Scarlett, let's end with some take-home messages that you want to leave with the Kevin MD audience.
So, probably my biggest take home message would be that mental health deserves the whole picture. So, even if a therapy sounds too alternative or quackery, we must be conscious of our mental biases and really assess the studies and assess the research that is out there. So, and we also can't afford to treat the body and the brain separately. So addressing something like vitamin D deficiency can definitely change lives. And our medical training and practice should do everything it can to catch up to that emerging evidence.
Scarlett, thank you so much for sharing your perspective and insight, and thanks again for coming back on the show.
Thank you so much, Dr. Fo.